What is HIV? HIV stands for Human Immunodeficiency Virus. HIV is the virus that causes AIDS, the acquired immunodeficiency syndrome. This virus is passed from one person to another through blood-to-blood and sexual contact. An infected pregnant woman can also pass HIV to her baby during pregnancy or delivery, as well as through breastfeeding. People with HIV have what is called HIV infection and are referred to as being HIV positive. A positive HIV test does not mean that a person has AIDS. Scientists estimate that people with HIV infection will develop AIDS within about 10 years after becoming infected. However, not everyone develops AIDS within this amount of time, and it may take as long as 20 years. The time it takes for someone who is infected with HIV to develop AIDS varies from person to person and depends on many factors, including a person's overall health and their health-related behaviors, what medications they take, and how early the infection is detected. With appropriate treatment with antiretroviral medication, a person can have a healthy, productive life. What is AIDS? AIDS refers to a group of illnesses that result from having been infected with HIV. These illnesses develop because our immune system, our body's mechanism for fighting off infections, can no longer do its job. As a result, the body becomes vulnerable to a variety of illnesses called opportunistic infections. Some of these infections that can be life-threatening for a person with AIDS are rarely seen in individuals with a normal immune system. How has HIV/AIDS affected Hispanics? Since the beginning of the AIDS epidemic, Hispanics have been disproportionately represented among persons with HIV and/or AIDS. According to the CDC, AIDS cases diagnosed among Hispanics have increased from 15% in 1985 to 19% in 2005. Hispanics aged 20 to 24 accounted for 22% of new AIDS cases among young adults, but represented 18% of U.S. young adults in 2005. Most Hispanic men have been exposed to HIV through sexual contact with other men, followed by injection drug use and heterosexual contact. Most Hispanic women have been exposed to HIV through heterosexual sex, followed by injection drug use. What are the risk factors for acquiring HIV infection? Engaging in high-risk behaviors puts us at risk for HIV infection. A person is at risk for becoming infected with HIV if they engage in the following behaviors: unprotected sex, vaginal penile intercourse, anal sex, or oral sex. Share needles to inject drugs, to pierce parts of the body, or to get tattoos. A woman who is HIV positive and pregnant can also pass the virus to her child during pregnancy, labor and delivery, and through breastfeeding. Because of new medications, pregnant women can be treated with antiretroviral medication during pregnancy, lowering the risk of mother-to-child infection from 25% to 2% or less. If antiretroviral drugs are started during labor, decreased rates, less than 10%, of perinatal transmission can still be achieved. How do I prevent HIV infection? Do not have unprotected sex. Use a latex condom at every sexual encounter and use it correctly. If you feel uncomfortable talking to your partner about using a latex condom, you probably shouldn't have sex. Do not share needles to inject drugs. Do not share needles if getting a piercing or tattoos. How can I tell if I am infected with HIV? The only way to determine if you are infected is to be tested for HIV infection. Persons at high risk for HIV infection should be screened for HIV at least once a year. You cannot rely on symptoms to know whether or not you are infected with HIV. Many people who are infected with HIV do not have any symptoms at all for many years. Infection with HIV can weaken the immune system to the point that it has difficulty fighting off certain infections. These types of infections are known as opportunistic infections because they take the opportunity a weakened immune system gives to cause illness. The following may be warning signs of infection with HIV: rapid weight loss, dry cough, recurring fever or profuse night sweats, profound and unexplained fatigue, swollen lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, white spots or unusual blemishes on the tongue, in the mouth, or in the throat, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurological disorders. However, no one should assume they are infected if they have any of these symptoms. Each of these symptoms can be related to other illnesses. Again, the only way to determine whether you are infected is to be tested for HIV infection. How is AIDS diagnosed? AIDS is the most severe manifestation of infection with HIV. Only a doctor can make a medical diagnosis of AIDS based on specific criteria established by the CDC. An AIDS diagnosis in an adult or adolescent 13 years or older is defined by the presence of one of the 25 AIDS indicator conditions and having a CD4 cell count less than 200 cells per cubic millimeter. How is AIDS treated? Currently, there is no cure for AIDS. Today, there are medical treatments that can slow down the rate at which HIV weakens the immune system. There are antiviral medicines to reduce the viral load, amount of HIV in blood, and other medicines to treat or prevent opportunistic infections that can occur when someone is HIV positive. There are other treatments that can prevent or cure some of the illnesses associated with AIDS, though the treatments do not cure AIDS. As with other diseases, early detection offers more options for treatment and preventive health care. If you are HIV positive, you can take an assortment of medicines and treatments that will not only lengthen your life, but also help you maintain the best quality of life possible. You can call Su Familia, the National Hispanic Family Health Helpline, at 1-866-SU-FAMILIA. The helpline provides free, reliable, and confidential health information in Spanish and English, as well as referrals to free or low-cost healthcare services in your community.